healthcare sector landscape unfolding at this point in time? How do you see healthcare providers splurging when you look at the present scenario?
Hi. As we were talking about earlier, every cloud has a silver lining. We went through the dark clouds of Corona, and healthcare in general took a severe beating. But fortunately for us, healthcare has rebounded with a vengeance. And I think the scope of healthcare seems to be very, very bright. And we do expect healthcare to grow exponentially in the next few years.
So what are the challenges, broad challenges that you see for the healthcare industry in India? Do you think affordability, accessibility are still at large when you see that?
See, I think there were many problems in the health industry in the past. For instance, many years ago, we were far behind the Western world in the delivery of healthcare. But now we have healthcare that's in par with any country in the world, and I would say in some cases better than some parts of the world. We have everything that's available in New York, London, or any of the Western cities that's available in Bangalore. So that way I think we have certainly come a long way. The problems that we see is one, accessibility and affordability of healthcare. See, in the US you have the Medicare, in the UK you have NHS, which takes care of the healthcare needs of the patient without any out-of-pocket expenditure. Unfortunately, in India, there is still a huge amount of out-of-pocket expenditure on healthcare, and which restricts the availability of healthcare and accessibility and affordability of healthcare to a large sections of the society. Fortunately, even this is changing. When I came back from the USA about 30 years ago, about 5 to 10% of my patients had some kind of insurance. Now it's well over 60%, but even then there's a large number that doesn't have any kind of insurance coverage, and that is something that we need to work on, because healthcare is the fundamental right and it should be available to every citizen of this country.
Absolutely. There are also, challenge in India when you look at the diseases. We have chronic diseases, NCDs taking the load of the challenge going forward of the diseases is on the lifestyle diseases, and we are also seeing AMR, which will come up as a big challenge. What do you think about these subjects?
I think it's very unfortunate that even though we are considered a developing country, we have been hit hard by both communicable diseases and non-communicable diseases. Whereas the Western world is mostly non-communicable diseases, we have a combination of both. We still see dengue, malaria, cholera, tuberculosis, so on and so forth, and also a huge burden of non-communicable diseases like diabetes, hypertension, cancer, heart disease, kidney disease, so on and so forth. In fact, now the major causes of mortality in our country is because of NCDs. They have overtaken communicable diseases as the single largest causation of mortality in our country. Of course, COVID changed the perspective a little bit, but I think for a developing country, it's a huge burden on our resources to take care of both NCDs and communicable diseases. So that's another big challenge we have. The other challenge I see is that for various reasons, at least 70 to 75% of the healthcare in India, especially the tertiary healthcare, is in the private sector, which means obviously the care for patients would be more expensive because it's in the private sector, and that's another challenge we have. So we essentially now are delivering first world care at third world costs. So the expectations of the people are high, but modern healthcare is expensive, and hence someone has to pay for it, and that's a challenge that we need to overcome in the future.
Going forward, what do you think will be the solution to counter these challenges?
See, I think one of the major things that all of us, the government, the private sector, and the private insurers need to work on is providing universal health insurance, not necessarily universal health care. If you have universal health insurance, then most people could get treatment like what's happening in the Western world. So we should work on getting insurance for each and every citizen of this country that is viable, reasonable, and then the patient has a choice of taking his care or her care in whichever hospital he wants to.
Absolutely. So what do you think about the growth of the healthcare industry and healthcare providers industry? And when we talk about Manipal Health Enterprises, what are some of the future plans that you can tell us? Are there any expansion, organic or inorganic, in the pipeline?
Certainly, I think it's been a good last few years for the Manipal Group. As you're aware, we have expanded quite a bit and we have added a lot more beds. Now we have about 28 hospitals in 16 cities across the country, and we are looking at further growth, both organic and inorganic. And without sort of going into the details of them, wherever there's a good opportunity, we think we would certainly want to take it. And right now we have been predominantly concentrating on tertiary care hospitals of about 300 beds or so across the various cities, but we are open to any other opportunities. So we have greenfield, brownfield, and also both organic and inorganic growth.
Any highlights as to where the next set of expansion is expected, in which cities?
I would not want to get into those details. However, certainly we feel we have less representations in the east and the northeast of the country. So that's where we are looking at some of our expansion programs.
Well, thank you so much, Dr. Ballal, for joining us. It's been a pleasure asking questions. Thank you so much.
It's been my pleasure being here. Thank you very much.